With a spike in cases comes an increased demand for coronavirus tests. People across Metro Detroit reporting long lines at local urgent care centers this week, which has led to a shortage of tests.
Big time shortage. And our Brett Cass has been looking into the issue. He's live in Royal Oak tonight to explain what this means for those searching for a test. Brett, we're talking about long lines for folks.
Yeah, definitely long lines and also the shortage as you talked about. It's important to note, though, there are two different types of tests. One is that antigen testing, which is usually the rapid test you will get at an urgent care. And there's also the PCR test. That's usually the more accurate one that is done at hospitals. And right now, demand for both is making it more difficult to get a test. For weeks, urgent cares like this one in Madison Heights have seen long lines as some people wait hours for a rapid COVID test.
Before you would be able to find a parking spot. Now it's very difficult to find a parking spot.
As positivity rates skyrocket, hospitals are struggling to get enough reagent to run the more accurate PCR test.
Once we reach a certain limit, we can't test anymore. So once we've reached our 80 or 100 tests for that day, we no longer can test people. We've just run out of reagent.
Beaumont Hospitals is limiting how many tests they now run, saving the reagent for those most sick.
So we have to conserve it for people that really need the test immediately. The other ones can be sent out, and hopefully turnaround times will improve.
That turnaround time slowing down. At Henry Ford Hospital, results that once took 24 hours now take 48, with doctors blaming a shortage on reagent.
Definitely something that we need to deal with, and we are working diligently to make sure that we have the supplies.
But this test is different than the rapid antigen test done at many urgent cares. Those tests don't need reagent and aren't impacted by the shortage. However, they are not as accurate.
So the antigen test is a good test, but if you really have symptoms and it's negative, you need to go to the next step and get one of the PCR tests.
That's why doctors say you shouldn't rely on those results if visiting family, urging people to avoid contact and wear masks to slow the spread.
None of our tests are 100%. So, if you have symptoms, stay home, save your family.
And Dr. Gitzinger also said that hospitalizations are increased here at Beaumont Hospital. And he said if you have mild symptoms, it's important just to isolate and to stay at home. Reporting here in Royal Oak, I'm Brett Cass, 7 Action News.